I am Dr. Meera, Professor in Department of Anatomy. Today we are going to describe about the primitive streak. Primitive streak is in your competency. The number is AN 79.1. So here you have to know about the formation and fate of the primitive streak. So what is primitive streak? So primitive streak development is noticed on the beginning of the third week of intrauterine life. So this appearance of the primitive streak in the embryonic disc determines the beginning of the gastrulation. So we all know what is gastrulation. Gastrulation is a process where the bilaminar germ disc is converted into a trilaminar germ disc. Okay. So what are the layers in the bilaminar germ disc? There will be an epiblast and there will be a hypoblast. Okay. So the blue one is the epiblast and the yellow one is the hypoblast. So this two bilaminar germ cells is converted into a trilaminar germ disc. Okay. So the formation of the primitive streak in the germ disc determine the beginning of the gastrulation. Okay. So the embryo at this stage, it is called as gastrula. So what happens? Where does this primitive streak develop? So it develops at the caudal end of the embryonic disc. So what you are seeing here is the embryonic disc. There is a cranial end and that is a caudal end. At the caudal end of the embryonic disc, you are going to see a linear narrow groove which is called as primitive streak. Okay. So this primitive streak is happening in the third week of intrauterine life. So what are the other events happening in the third week of intrauterine life? One is the appearance of the primitive streak, next development of the notochord, then the differentiation of the 3 germ layers. Okay. So what are the things happening in the third week of intrauterine life? One is the differentiation of the germ layers, development of the primitive streak and the development of the notochord. Okay. So this notochord appearance is started to notice on 15th to 16th day. On 15th to 16th day of intrauterine life, the primitive streak starts appearing as a linear narrow groove at the caudal end of the embryonic disc. This primitive streak is narrow groove. On either side there will be a slight elevation. The cranial end of this groove, primitive streak, shows a knob-like elevation which will be called as primitive node. This knob-like elevation, the primitive node, shows a central depression which will be called as primitive pit. Okay. So the primitive streak is a narrow linear groove which is seen at the caudal end of the embryonic disc, while the cranial end of the primitive streak shows a knob-like elevation and the center of this elevation shows a depression which is called as primitive pit, while the elevation is called as primitive node, otherwise it is called as Hensen's node. Okay. So now what happens? So this primitive streak is appearing in the epiblast layer. Okay. So what happens? The epiblast cells from the caudal end of the embryonic disc starts migrating through this primitive streak. As the cell starts migrating, the shape of the epiblastic cells becomes a flask shaped. As these flask shaped cells starts invaginating from the epiblast, they go and replace all the endodermal cells. They replace the endodermal cells. Okay. So the endodermal hypoblastic cells which were there are replaced by the newer migrating epiblast cells. After the replacement, this hypoblastic cells layer, it is now called as definitive endoderm. Okay. After the formation of the definitive endoderm, more epiblastic cells will be migrating through the primitive streak and they come to lay down between the epiblast and the definitive endoderm. These migrating newer cells will be laying down, and these cells are called as intraembryonic mesoderm. Okay? So, epiblastic cells, then you have a definitive endoderm, in between layer is the intraembryonic mesoderm. Okay. So, as these intraembryonic mesoderm cells are migrating more and more, they will be migrating all over the embryonic disc. Okay, they will be migrating all over the embryonic disc. They move laterally, cranially and caudally. Except in two places, they do not go between the two layers of the ectoderm and endoderm. That is, one at the precaudal plate. At the precaudal plate is seen at the cranial end of the embryonic disc. So, what is this precaudal plate? Precaudal plate is the area where the epiblast and the endoderm, hypoblast cells will be adherent to each other. Okay. So, the epiblastic cells which are invaginating through the primitive streak, first it is going to replace all the hypoblastic cells to form the definitive endoderm. Later, more epiblastic cells will be migrating and they lay down between the ectoderm, epiblastic and the definitive endoderm to form a third layer in between, which is called as intraembryonic mesoderm. So, this intraembryonic mesoderm is present all over the embryonic disc except at two places. One at the precaudal plate. Precaudal plate is a junction where the epiblast and the hypoblast are adherent to each other. And one more place is the cloacal membrane, which is seen at the caudal end of the embryonic disc. Okay. So, this precaudal plate is going to contribute for the future oropharyngeal or buccopharyngeal membrane. So, this buccopharyngeal membrane will give rise to the oral cavity. Okay. So, now we have learned how a bilaminar germ disc is converted into a trilaminar germ disc. So, now why this primitive streak has developed? What is the fate of it? So, it is going to help in determination of the craniocaudal axis of the embryo. So, which will help in the determination where the head region is going to develop, where the lower limb is going to develop. And it also determines the right and left side of the embryo. Then it also determines the ventral and the dorsal surface of the embryo, and it also contributes to the development of the intraembryonic mesoderm, notochord and septum transversum. So, this is the functions of the primitive streak. Okay. So, that is about the formation and fate of this primitive streak. Now, this primitive streak has to degenerate. Persistence of this primitive streak cells is going to give rise to a common condition in newborn, which is called as sacrococcygeal tumors. We know that primitive streak are developed at the caudal end of the embryonic disc. So, persistence of this primitive streak cells can give rise to a teratoma at the sacrococcygeal region of the infants. Okay. So, when we cut open the tumor, you can find all different kinds of tissues in the tumor. That is why? Because this tumor is contributed by all the three layers of the germ disc. Okay, so you can find enamel, teeth, hair, everything can be seen in this sacrococcygeal tumors. There is one more condition due to a defect in the gastrulation. Okay, that condition is called as caudal dysgenesis, or it is called as cyanomelia. This condition can occur in mother who has maternal diabetes or any toxic insult to the mother during the period 3rd week of intrauterine life, or any genetic abnormalities can also give rise to this condition. So, what has happened here? This condition is also called as mermaid baby. So, as you can see in the picture, the baby looks like a mermaid. Why? because the caudal end of the body has fused. You can see the lower limb, its character is it looks like a mermaid. The two lower limbs has fused with the feet facing laterally. So, it looks like a mermaid tail, isn't it? So, that is why this condition is called as mermaid baby, or it is called as Sirenomelia. Okay. So, now why this has happened? So, I have told about some few causes. Apart from that, if there is less number of intraembryonic mesodermal cells are present at the caudal region of the embryonic disc, will also lead to this condition. Okay. Very less number of intraembryonic cells, mesodermal cells can also lead to Sirenomelia. Okay. So, less intraembryonic mesodermal cells means all the derivatives which are from the intraembryonic mesodermal cells like urogenital system and lumbovertebral region, all that deformities can be seen in this Sirenomelia babies. Okay. So far in this session what we have discussed is primitive streak formation and fate and its applied aspects. Okay. Thank you.